Welcome to the Fan Method, the aesthetics, health, and wellness podcast dedicated to helping you look and feel your best, inside and out. I'm your host, Dr. Larry Fan. So let's talk about everyone's favorite topic, Ozempic. Or should I say in today's world, maybe it's also Zepbound. But Ozempic, breakthrough weight loss medication, is helping thousands of people to lose the weight they've never been able to lose. It turns out that they're also leaving people with bodies they don't recognize. In this episode, we're going to talk about what weight loss means and the effects it can have on your body. We're going to discuss why losing weight doesn't always mean looking better. We're also going to talk about the hidden cost of rapid weight loss. And we're going to talk about what happens to your body after you lose a lot of weight. I had a patient come to see me last week. She'd lost 80 pounds. And when she told me about her journey, she was so excited to lose the weight. And as she lost the weight, she was feeling better and better. But then at the end of it all, she looked in the mirror and she was actually like deflated and depressed because of the way her body looked. She told me, gosh, you know what? After losing the weight, I thought I'd feel so good about myself, but I actually feel even worse. For all of you out there that have either gone through this process and you've got this extra skin, or you're, about to embark on your weight loss journey, or you're losing the weight right now, and, now you know that, hey, being left with extra skin may be an issue. I want you to know that you don't have to live with it. Losing weight is the first step, but it's the sculpting that is sort of the final step that can help you sort of truly be your happiest, most confident self. So let's talk about what we call the Ozempic Makeover. So that is makeover procedures designed to help sort of restore the body and face to sort of a firm and fit appearance after you're going through major weight loss from treatments like Ozempic and Zepbound. There are so many patients now who've lost all this weight, but they're stuck with all of this extra skin. The body, but then also the face. The face also loses volume, becomes deflated. After losing weight, there are three main things that happen. So number one, the body shrinks. The skin has some collagen and elastin to be able to shrink a little bit to fit your new shape. But in many situations, if you've lost a lot of weight, and I'm talking about, 50, 100 pounds or more, but sometimes even if you've lost a little bit less, like 30 pounds, people are, often left with some extra skin because the skin isn't able to shrink to fit your new shape. On top of that, when you lose weight, you will lose volume from all over your body. That can cause sort of hollowing of the face, and that's led to the term called Ozempic face. But it can also lead to deflation of the breasts and also the buttocks, and there are terms for that now: Ozempic butt and Ozempic breast. Imagine getting help to be able to achieve a body and a face that not only is slimmer but also firmer. And that's what an Ozempic makeover is all about. Patients who are left with extra skin, the mainstay is going to be uh, body contouring procedures designed to remove the extra skin, also to sculpt any remaining fatty deposits. Patients who've lost a lot of weight, the mainstay procedures are going to be body lifts, tummy tucks, extended tummy tucks, and then also procedures like breast lift and butt lifts, for those areas of the body. On top of it, some patients are going to be able to benefit from restoring the lost volume, especially in the face, the breasts, and the buttocks. And with the face, we're talking about a combination of restoring volume with fillers or fat transfer. There can also be a place for some skin tightening, and that can be using energy like radiofrequency microneedling and laser. And in some circumstances, particularly for the lower face and the neck, face and neck lift procedures. Let's talk about what sort of, what that really feels like. Most commonly, it's going to be a version of a tummy tuck or a lower body lift, which is a 360-degree version of a tummy tuck, combined with some selective liposuction to contour the remaining fatty deposits. For patients that have issues with breast deflation and sagging, some combination of a breast augmentation and a breast lift. And then for patients with issues with Ozempic face, potentially restoring lost volume with fillers or fat transplantation, and then tightening the skin either non-surgically with energy-based treatments like laser radiofrequency, or for patients with more, with more severe sagging, surgical face and neck lift procedures. So let's talk about what are some of the biggest misconceptions about, Ozempic makeovers. A lot of people believe that their skin is just going to tighten itself over time, either on its own or through working out or even more dieting. And unfortunately, that isn't true. When you've lost a lot of weight, the real issue is that your skin has just been stretched out and it can't and won't shrink to your new size. And so, if that is a significant problem, the only real solution is a makeover. And let's now talk about, another myth. A lot of patients, they think about getting some help. They think about getting a makeover, but they feel like getting a makeover is a shortcut, that it's doing something that's wrong, and that they should just be able to sort of put in the hard work of just eating better, exercising more, and being patient. Getting exercise, eating right, always foundations for health, always important to do, but they're not going to get rid of the extra skin. They're also not going to restore that volume that's been lost. Let's talk about some of the other misconceptions that we have. Many patients need to get help sort of all over the body, the tummy, the thighs, the buttocks, the breast, the face. And sometimes, people want to get everything fixed. And sometimes they think, hey, I can get everything fixed in one surgery. And, occasionally it's possible to do what we call a total body makeover if you happen to be the right candidate. But in most situations, when we're dealing with multiple areas, we need to sort of stage the procedures. Ultimately, whenever we're doing any treatment, safety comes first. Safety is always the number one priority. And so, if it's possible to combine procedures to address more than one area at a time, that can be considered. But for patients who need to have the entire body and face sort of improved, often we need to sort of stage things into multiple procedures. So let's talk about some of the biggest mistakes that people make. A lot of patients end up, they're going through the process of losing weight. And they're starting to see that, hey, I'm shrinking a little bit, but I'm beginning to see some hanging skin. But they want to get to sort of their end goal. They sort of envision, they dream about having that sort of svelte and firm and tight body. And so sometimes patients will even come to see me saying, hey, can I accelerate this? Can I get sort of some lipo, or can I get a body lift or a tummy tuck sort of like now? Because I can already see I've got these problems. But sometimes people want to get things done too soon. One, common sort of issue that we always need to address is, when is the right time to sort of have your makeover? And really the best time, really the closer you are to your goal weight, the better your end result is going to be. So if you're still in the process of actively losing weight, I and most surgeons would suggest that, hey, the right time for the makeover is after you've lost the weight. You're at a place where where you feel good, and you also know that you can sort of maintain the weight. Then you come in to have the makeover to take care of everything that's left behind. But if you do sort of, the surgery too soon, for example, while you're still losing weight, then we're ending up, we're working on sort of, a body that's still changing. And so we're not going to be able to sort of do what's optimal for where you'll really end up being. Another common mistake that I see is not doing your diligence in choosing a good surgeon. Convenience is an important factor, accessibility is an important factor, but ultimately, the single most important choice that you're going to make is choosing a good surgeon, because your surgeon is going to be the one that's going to be taking care of you. They're going to be the one that's going to be helping you sort of design the right treatment plan. They're going to be the ones who are going to be performing the actual surgery. They're going to be the one actually taking care of you. Fortunately, surgeons have to go through a lot of training, so most surgeons are competent. But at the same time, in the cosmetic world particularly, it's a little bit of the Wild West. So turns out that, in an office setting, any sort of doctor is allowed to do any procedure on a patient as long as the patient's sort of willing to sort of get that done. So there is a world of people who call themselves cosmetic surgeons doing cosmetic surgery procedures like tummy tucks, but they don't have much of a background. They may have trained in other fields like internal medicine or family practice. So they don't have an actual background in surgery, but for some reason they decided to perform cosmetic surgery. And if you don't do your diligence, you may encounter someone who calls themselves a cosmetic specialist, but in reality, there's somebody that was tired of, doing their own specialty and learned cosmetic surgery, often like in a short course. Choosing a good surgeon, really, really important. The first sort of baseline for that is make sure it's a board certified plastic surgeon. So board certified and specifically in plastic surgery, because plastic surgery is the only recognized specialty within organized medicine of specialists that have been trained to perform, cosmetic and reconstructive surgery of the body. So requirement number one is board certified in plastic surgery, not in another specialty. But even on top of that board certification, is that itself enough? Well, board certification means that someone's gone through several years of training, has passed some pretty extensive tests to be able to be certified as a surgeon. So it definitely means something. But at the same time, surgeons still, like all groups, there are, good surgeons, there are not so good surgeons, there are, probably bad surgeons, and there are really, really great surgeons. And if you have a choice, what kind of surgeon do you think you want for yourself? If you see an average surgeon, you're probably most likely to get an average result. If you see a great surgeon, you're more likely to get a great result. If you see a bad surgeon, you can guess what kind of result are you more likely to get. And so I encourage everyone to choose a really good surgeon, ideally the best surgeon that you can find. Let's talk about the future, the sort of the future of sort of Ozempic makeovers. The future is regenerative medicine, peptide therapies, and body contouring like we've never seen before. Now, there are an emerging group of non-surgical treatments, that actually can help sort of firm and sculpt the body. It is important to always understand that non-surgical treatments aren't the equivalent of surgery. And if you have a lot of hanging skin, there isn't any non-surgical treatment that's ever going to remove that skin. But at the same time, we have some non-surgical treatments that can actually do some firming of the skin and can actually do some shrinking of fat and can also sort of uh, firm sort of the skin of the face and also sort of restore lost volume. And so those are some things always to be looking out for. Let's talk about another really exciting development in the world of cosmetics, surgery, and medicine. Artificial intelligence has given us the ability to sort of preview the potential results of surgery before you have the surgery. If you're curious about surgery, if you're wanting to have surgery, we now have the technology that allows us to sort of show you what things could look like. Now, obviously, any sort of simulation technology is not going to be 100% accurate, and it's not sort of going to be able to show you exactly what you will end up looking like, but it can give you a really good idea of what a makeover can do for you. Let's talk about what is the most exciting advancement in post weight loss makeovers right now. The most exciting development I've seen is the ability to achieve, sort of transformative results with less downtime. And through these procedures, we're helping all of these thousands of people who've lost weight. We're helping them not just transform their bodies, but really transforming their lives so that they can, sort of not just be healthier, but also be as confident and as happy with their bodies, as they can be. Let's talk about, the biggest takeaways from this episode. Number one, weight loss, medical weight loss particularly is transforming lives. Thousands of patients who've been, often struggling with being obese or overweight their entire lives are getting the help they need to be able to lose the weight and to keep it off. At the same time, weight loss itself, you know, generally is going to help sort of, people look better because they're going to be slimmer, but it doesn't guarantee a sculpted body. In fact, people who lose a lot of weight are often left with the opposite. They're often left with a lot of extra skin. That extra skin can be a source of frustration. That source of extra skin can also be a source of inconvenience and even discomfort. And so after losing weight, contouring is often sort of the next and often the last step for patients in their weight loss journey. The timing of your makeover is extremely important. It is smart to sort of lose your weight and also get to a place where you feel comfortable and also a place where you feel like you can maintain it before having your makeover. Ultimately, addressing sort of your problem areas and also sort of understanding your goals, really important so that you can have the right treatments, and then choosing the right surgeon is the choice that can make all the difference. If you'd like to learn more about sort of, if you've lost a lot of weight and you're struggling with extra skin or lost volume and you want to learn more, contact our office to book a consultation. We'll be happy to give you more information.